Hi, my name's Susie. I'll be your student nurse today. Can you tell me your name and date of birth?
My name is Annabella Flesh, and I was born June 25th, 2006.
Okay, great. I would perform hand hygiene. I'm going to gather any necessary equipment, assess for safety, lighting, close the curtain. Do you need to use the restroom?
Yes, ma'am.
Okay, great. So what I'm checking for is posture, gait, balance. All right. We're back from the restroom. Close the curtain. I would adjust the bed to a comfortable working height. We're going to do a physical assessment on you today. And we're going to start with your head and with your toes. Do you have any questions for me?
No, ma'am.
Okay. Do you know the date and where you are?
The date is September 13th, 2020, and I'm in the hospital.
Okay, great. So we're gonna, like I said, we're gonna do a head to toe physical assessment on you today. First, I would take her vitals. I would take a blood pressure. Normal range for an adult is 120/80. Respirations 12 to 20. Pulse 60 to 100. And temperature is 96.7 to 100.5. And I would assess pain. And then oxygen saturation, which is 95 to 100%. First thing we're gonna do, I'm gonna start with your head, like we said. I would inspect for swelling, erythema, which is redness, edema, which is swelling, tenderness. Does it hurt when I do that?
No, ma'am.
Okay, the next thing we're gonna do is I'm gonna palpate the ears, checking for skin integrity, any kind of drainage, erythema. Does it hurt when I do that?
No, ma'am.
Okay. The next thing we're going to do is I'm going to palpate the sinuses. Does it hurt when I do that?
No, ma'am.
Okay. So the next thing we're going to do, we're going to check the eyes. I'm looking for any kind of redness, drainage, anything like that. We're going to check the pupils, make sure they're equal, round, reactive to light, and accommodating. Okay. And everything looks good. Then we're going to check convergence. Can you follow my finger? Okay, great. Can you look at the wall and then look at my finger? Okay, great. The next thing we're going to do is I'm going to look at the nose, and I'm looking for any kind of swelling, redness, deviated septum. It looks good. Palpate. Okay, and then can you stick out your tongue? We're going to check the mouth, make sure it's moist and pink. Make sure nothing's swollen. Check to make sure there's no redness, swelling. Open your mouth a little bit more. Tenderness, tonsils look good. Everything looks good. Let me see your teeth. We're going to make sure they're all there, none are missing, and there's no tenderness or swelling. And the next thing we're going to do is I'm going to check the carotid pulse. I'm going to palpate the neck. Does it hurt when I do that?
No, ma'am.
Okay, and I'm going to check the carotid pulses. Symmetry's good, +2. We checked for skin integrity, swelling, redness. The next thing I'm going to check is skin turgor. It's elasticity of the skin, is how it bounces back to make sure she's not dehydrated. The next thing we're going to do is I'm going to palpate the arms to make sure there's no, checking the skin for texture, integrity, swelling, redness. Does it hurt when I do that?
No, ma'am.
Okay. The next thing we're going to check is the brachial pulse. And the pulse is strong, +2, symmetry's good. We're going to check the radial pulse. Strong, +2, symmetry's good. The next thing we're going to do is we're going to look in the hands. We're going to inspect the hands for skin integrity. We're going to look at the fingernails for any clubbing. That would mean she's not getting enough oxygen. And the next thing we're going to do is look for capillary refill in both of the fingers. And it's brisk. Looks good. All right, can you squeeze 2 of my fingers? And you just give 2 because you don't want them to break your fingers, and you're testing for strength. And that's good. Okay, the next thing we're going to do, Annabella, we're going to listen to your heart. Okay. All right, so the first thing I'm going to check is the aortic valve, which is on her right side, second intercostal space, midclavicular line. And I'm listening for any gurgling or swishing sounds. The next valve we're going to check is the pulmonary. And it's the second intercostal space on the left side. no gurgling or swishing. The next one we're going to check, it's at the it's at the fourth intercostal space on the right hand side, and that's the tricuspid valve. And finally, the mitral valve is on the mid-clavicular line, fifth intercostal space, and that would also be your apical pulse. And I would check the apical pulse for a full minute, assess that for a full minute. Okay, and then the next thing we're going to do is we're going to do breath sounds. I would have inspected and palpated for redness, swelling, tenderness of the chest. We'll get to the stomach in a minute. And for the sake of the video, normally we would do 5 spots on the front, 9 on the back, but for this video we just did 3. We're going to do 3 spots. Listen for 3 spots. And what we're listening for is stridor, rhonchi. Good. Take a deep breath for me. Good. Deep breath. I don't hear any wheezing. Doing good. Okay. Deep breath. Very good. One more. Okay. Okay. And I would have palpated. I palpated the chest and looked for the skin integrity, swelling, redness, which is erythema. The next thing we're going to do, can you turn for me? I'm going to check breath sounds in the lungs. Like I said, we're just going to check the 4 on the back. And I would palpate for texture, integrity of the skin. Does it hurt when I do that? Okay, great. So I'm listening for stridor, wheezing, rhonchi. Okay, take a deep breath. It's 1. Deep breath. Good. Deep breath. Everything sounds normal. Good. Deep breath. Good. Deep breath. Deep breath. Okay. And that's 4. Okay, I'm going to assist her lay down. Lay down for me. For the stomach, I'm going to look, listen, and then palpate. I'm going to look for the skin integrity, texture, make sure there's no redness, swelling, distension. And then I'm going to listen. I'm going to listen in the right lower quadrant first. And what I'm listening for is any kind of peristalsis to make sure everything's working and moving correctly. And then I'm going to go to the right upper quadrant, listening for the same thing, left upper quadrant, and then I would listen to the left lower quadrant. And then I'm going to palpate, make sure everything's not, does it hurt when I do that?
No, ma'am.
Make sure it's not tender and there's no problems there. Okay, the next thing I'm going to check would be, I'm going to palpate the legs for any redness, check the skin integrity. Does it hurt when I do that?
No, ma'am.
Okay, everything looks good. I'm going to check the femoral pulses. Good, symmetry's good, +2. The next thing I'm going to check is the popliteal pulses. Good, symmetry, +2. The next thing I'm going to check is the posterior tibialis. And that's good, +2. The next thing I'm going to check is the dorsalis pedis. Good, +2. The next thing we're going to do, I'm going to check her capillary refill in her toes, make sure it refills quickly on both extremities of the lower extremities, and it's brisk. And then I'm going to have you push against my hands. I'm checking for strength, and that's plantar flexion. And then can you push your feet up? And that's dorsiflexion. Strength is good. I would have checked the nails as well for the any kind of clubbing, any texture, any kind of abnormalities. And then I would assist her up. I would perform hand hygiene. And I would close the curtain. And that's all for our physical assessment. Thank you for your time.